Okay, by now you should have already gotten your Trans-D Tropin. Very simply, this is how you administer it. Shake it up a couple of times, and remember that you want to keep this in a room temperature environment. If your body becomes very uncomfortable at a certain temperature, it's not good for Trans-D. Anything greater than 105 degrees sustained more than 20 minutes will cause this to denature. So you don't want it to leave it out in your car or let it get too hot. If it gets into freezing, it's not good for it. So although you may be cold at 45 degrees, it's not going to hurt it, but it's going to be uncomfortable. Trans-D will be also fine at 45, but room temperature is the best place to keep it at 70, 75 degrees. Now this is how you take it. You're going to shake it up, make sure it's shaken up well, and you want to administer this in an area that has a high vascular supply, meaning there's a lot of blood flow to that area. One of the areas that's good is actually the forearms. It's thinner skin, so the Trans-D absorbs better through that. Simply take it, open it up, and now you're going to put 8 drops on the one arm. So it's 1, 2, 3, 4, 5, 6, 7, and 8. Now try to remember to close the bottle as you rub these 8 in, otherwise you're going to spill the Trans-D. Rub it in. Remember the dose is 15 drops 3 times a day, so you're going to rub in the first half. So in this case I just went with 8 on this arm, and then I'm going to put the remaining 7. Remember 8 from 15 is 7, so you're going to take 1, 2, 3, 4, 5, 6, and 7. And I'm just going to take the remainder and rub it in forearm to forearm again. Now, we don't want to do this on the dorsum of the arm, we call this the volar aspect, meaning the ventral aspect. You don't want to do it on the opposite side because the skin is thicker. So try to keep it on a thin surface area. For instance, the skin here over the platissimus muscle, it's very, very thin. It absorbs easily there. You'd want to try to keep it away from your hands. The reason the skin on the hands is thicker. You can also use it on the inside of your thighs or the gracilis muscle. Again, forearm to the inside of your thigh if you need to. In about 2 to 3% of the people, we have noticed a small minor rash that appears, and it's usually only a week to 2 weeks out, and simply rotating the sites of administration will take care of that problem. Most people say that if they did have that problem, and as I said, it's only 2 to 3% of the people, they say that it disappears after a couple of weeks. The other thing to remember is that you notice that when I put the drops on there, precision is not the key here. In other words, how big the drop is. Some people say, well, the drop looks bigger, it looks smaller, some drops are bigger, some drops are smaller. It's actually related to the surface tension. So if the forearm is already wet from rubbing in the first dose, you'll notice that when you put the next set on, they'll be flatter and they'll look bigger, but they're actually the same size. But think of this as a threshold function. What I mean is that if a dog is going to clear a fence that's 4 feet high, whether he jumps 3 feet, 3.5 feet, 3 feet, 11.5 inches, he's not going to clear that fence. But as soon as he jumps 4 feet, he's going to clear that fence. But if he goes 5 feet, 6 feet, 7 feet higher, it doesn't make any difference. It's the same thing, he's clearing the fence. So with Trans-D, it's a threshold function. We want to make sure that we hit that threshold and get the action potential up there, meaning that as long as the dose is a sufficient amount of dose, it's going to trigger the body to release that growth hormone. It's going to tell the body, release the growth hormone, and it's not based upon the amount that you're giving, but rather at how much of a dose that your body needs in order to get that flip, that switch flip. That's what it comes down to. So hopefully that's clear. You just want to make sure, it doesn't make any difference how much strength you exert when you flip that switch. We just want to make sure we flip that switch. So the dose is not dependent on the precision of the drop, so don't get worried about that. You want to make sure that you administer it 5 days on, 2 days off, making sure that when you take the Trans-D Tropin, you space it out three times equally throughout the day. Earliest time to take it is 7:30 upon rising, because remember that's the common time for the body to release growth hormone. The bedtime is another time that the body naturally releases growth hormone, and then mid-afternoon is a lower surge than those 3. There's about 5 different times that the body naturally releases growth hormone. So you want to try to pace it as best as you can along those times. So that's in the morning, upon rising, right before going to bed, and then sometime around between 4 and 6 in the evening, closer to the 4 than the 6 time period.